everyone, my name is Rina Nipangi, a caregiver trainee. Today, I will show you on how to perform the baby bath assessment. In this video, you will learn the proper procedure in taking a bath for a baby and also the do's and don'ts in taking a bath for the safety of the baby. So, let's start. First, you need to provide a privacy area for a baby, and the best time to take a bath is from 9 to 10 in the morning, and the best place is on the countertop. The water temperature should be 29.4, not too hot and not too cold, while the room temperature is 24 degrees Celsius. Now, let's turn off the air conditions, electric fans, close the doors and windows in order to prevent the baby from chilling, vomiting, and aspirations. Be sure that you already turn off the air conditions before you taking a bath for a baby for about 10 to 15 minutes longer. Now, let's proceed. Do the proper hand washing. And puff it dry. Now, let's gather all the materials we need. So, I have here bathtub filled with water, baby blanket, diaper, clean clothes, towelette. Our towelette should be 5 to 6 pieces in order you to have an extra. Alcohol, shampoo, soap, 2 basins with warm water, rectal thermometer, grooming kit, cotton buds, cotton balls, feeding bottle, petroleum jelly, tissue, rubber mat, laundry bin, and garbage can. And now, let's do the proper hand washing again. Then, puff it dry. Now, get the baby from the crib using your 2 hands. And place the baby on the countertop. By the way, this is an important reminder for everybody that do not leave the baby unattended even for a single second, because the baby will quickly drown in only 1 inch of water. So, let's be careful for that. And be sure that the baby is safe all the time. So, let's assume that our baby is a girl. Let's undress the baby. Starts from the lower extremities. Remove the pants. And put in laundry bin. Check the diaper if soiled. Let's unfasten the diaper. Use the top part of the diaper, which is the cleanest part, and wipe from top to bottom. And put it underneath the buttocks of the baby. Now, check if there is redness and irritations so that you can assess it immediately if there is. Now, get a cotton balls, dip with water, and squeeze. Let's clean the genital area of the baby. Then, discard. And do it to the other side. And discard. Get another cotton balls. Do it in the middle part, including the labia, as well as the inguinal area from top to bottom, going to the anus. Then, discard. Get another cotton balls, dip with water, and squeeze. Repeat until thoroughly clean. and then discard. Now, puff dry. And get another cotton balls. Dip with water and squeeze. And if the baby is a boy, clean the side of the scrotum, including the inguinal area down to the anus. Then, discard. Get another cotton balls. Dip with water and squeeze. Repeat until thoroughly clean. And then discard. Now, get a cotton buds. Clean the side of the scrotum in horizontal motion. Then, discard. Get another cotton buds. Do it to the other side. Then, discard. Now, get a cotton balls. Dip with water. And squeeze a little amount of water into the penis of the baby. Then clean from top to bottom and repeat until thoroughly clean. Then discard. Now puff it dry. So, remove the diaper of the baby. Fasten the diaper. And put in plastic. Seal it. And put in garbage can. Now let's cover the baby. Then let's do the proper hand washing again. And puff it dry. Now let's proceed for the temperature of the baby taken from the rectal rack. For those who are asking why do we need to take a rectal temperature rather than the axilla and the oral temperature, the reason why is that a rectal temperature is the exact way to know if the baby has a fever. A temperature taken from the rectum is the closest way of finding the baby's body's true temperature. So that's why a rectal temperature runs higher than those taken from the armpit or the mouth because the rectum is warmer. So that's the reason why do we need to take a rectal temperature. So for now, let's proceed. Get the rectal thermometer. For me, I use this one. So let's assume that this is a rectal thermometer. But be sure, in actual, use a real rectal thermometer. So, let's clean. In cleaning the rectal thermometer, get a cotton balls. Pour it with alcohol. Then, clean from the bulb to the stem, going to the tip in circular motion. Then read the mercury level and can-eye level. Give 36.5 and above. Make it once. Be sure that there is no obstruction. Read again. And check the order level 36.5. Then, dip the valve in petroleum jelly. Now it is ready to insert on the rectal wrap. Grab the feet of the baby with your free hand in a sideline position. Then insert the rectal thermometer for about 0.5 inch for 2 minutes. Then remove the thermometer and clean using the dry cotton. From the tip to the stem, going to the valve. Then discard. Now read the temperature of the baby. And after that, put it back on the container. Now get a tissue. Clean the excess petroleum jelly on the buttocks of the baby to the rectal area. Then discard. Now let's proceed the proper hand washing again. Then puff it dry. And now let's proceed for the tapping procedure. Let's undress the baby. The upper extremities, remove the clothes. Widen the armhole. Gently pull the clothes. Then do it to the other side. Support the head of the baby. And then put in laundry bag. Now get 2 basins with water. Check the water temperature using your elbow or wrist. It should be warm. Then get a cotton balls. Let's clean first the eye of the baby. Dip with water. From top to bottom, upper inner to outer canthus. Then discard. Lower inner to outer canthus. Then discard. Then do it to the other side. Upper inner to outer canthus. Lower inner to outer canthus. Now get another cotton balls. Dip with water and squeeze. Clean the nose bridge of the baby, including the sides. Then discard. Get a cotton buds. Clean the outer part of the nose. Repeat until thoroughly clean. Then discard. Now get another cotton balls, dip with water, and squeeze. Clean the upper lip of the baby and also the lower lip. Then discard. Now get the cotton buds. Clean the outer part of the ear of the baby, including the back part. Then discard. Get another cotton buds. Do it to the other side. Clean the outer part of the ear. Same to the back part of the ear of the baby. Then discard. Now, let's clean the face of the baby. Get a towelette. Soak and wring. Then, do a knot and fold. Clean from the forehead, down to the cheek, down to the chin. And soak and wring. Do it to the other side. From forehead to the cheek, down to the chin. Now get another towelette and puff it dry. And now let's proceed for shampooing. First, check the head and scalp of the baby. If there is redness and irritations, use a special shampoo. Then, get a 2 basins with warm water. Check the temperature. Then, get the baby, put in a football hold position with your arm supported at the back and your hand supported at the head of the baby. And you will use your 2 fingers to cover the ears of the baby so that the water will not enter to the ear. Now, get a towelette. Make a blindfold. Be sure that the blindfold does not cover the ear of the baby. Put the baby, lower the head than the body. Then, with the baby's head, including the occiput, and get an ample amount of shampoo. Then gently massage the scalp and head of the baby using your 2 fingers, including the occiput. And then to the other basin, rinse the shampoo. And now get the blindfold. Then use it for puff dry. And put the baby back on the countertop. Then cover the head of the baby. And now let's proceed for weighting the body of the baby. So let's expose the body parts. Get a basin with water. Check the water temperature. It should be warm. Using your elbow or wrist. Then get a towelette, soap, and ring. Then do hand net and fold. Let's wet the body of the baby. Starts from the neck, from medial to lateral, going to the chest, medial to lateral, down to the abdomen, medial to lateral. Then soap and ring. Do hand net and fold. To the arms of the baby, the axilla, going to the hands, and pay attention to the interdigits of the fingers. Then soap and ring. Do hand net and fold. Do it to the other side. From the arms, the axilla, down to the hands of the baby, and also pay attention to the interdigits of the fingers. Then soap and ring. Now let's proceed for the lower extremities of the baby. Pay attention to the folds and creases of the baby. Same also to the interdigits of the toes, including the foot. Then soap and ring. Do hand net and fold. Do it to the other side. Again, pay attention to the folds and creases of the baby. Same to the interdigits of the toes, including the foot. Then soap and ring. Do hand net and fold. Let's proceed to the back side of the baby. Grab the feet in a sideline position. From the top, going to the buttocks area. Then soap and ring. And now, let's proceed for soaping. Get the soap. I prefer to use liquid soap rather than the bar soap because it promotes a bonding to a baby. A touch therapy between a caregiver and a baby will grow. So that's why I use this. So, get an ample amount of soap. Lather in your palm. Then, gently massage the soap. Starts from the neck, in a circular motion from medial to lateral, going to the chest, medial to lateral, and to the abdomen, medial to lateral. Then, get another soap. And to the upper extremities, from the arms to the axilla, down to the interdigits of the fingers. Let's pay attention for this. Then, get another soap again. Do it to the other side. Arms, the axilla, down to the hands. And pay attention to the interdigits of the fingers. Now, let's proceed for the lower extremities. Get an ample amount of soap. In circular motion, down to the folds and creases. Also, pay attention to the folds and creases, including the interdigits of the toes and the foot. Again, another soap to the back area of the baby. Grab the foot in a sideline position from the top down to the buttocks area. Now, the baby is ready for rinsing. So, get the baby from the countertop and put in a cradle hold position with your arms supported at the back, going to the buttocks area. Then, place on the bathtub in a semi-sitting position. Now, make sure that the head of the baby is above at the water level, and also make sure that the head of the baby will not bounce to both sides of the bathtub. So, now let's start for rinsing. And turn the baby towards you. Then rinse the back, going to the buttocks area. Then after that, get the baby. Then after rinsing, get a new baby blanket. And put the baby back on the countertop. Then puff it dry. Now, get a petroleum jelly, put it on the diaper area of the baby to avoid rashes and irritations. Then, get a diaper. Grab the feet of the baby, then gently put the diaper underneath the buttocks of the baby. Let's fasten the diaper. Be sure that your diaper snugly fits to the baby, not too loose and not too tight. Then, let's dress the baby. Starts from the upper extremities. Get new clothes for a baby. Widen the armhole. Gently hold. Then, do it to the other side. Hold the head of the baby with your hands. And, same procedure. Gently widen the armhole of the baby. And, tie at both sides. Send to the other side. Be sure that if you do this, not to tie to the baby, so that the baby will feel comfortable. And then, the last one. Now, let's proceed for the lower extremities. Let's wear for the pants. One foot at a time. Be careful for this. And gently grab the feet of the baby with your free hand. Okay. Do it to the other side. So, the baby now is very comfortable. So, if you have a cup, it is better to wear it the cup for outside. If the baby wants to go outside, so you should have to use it. But if you are inside of the house, it is not necessary. Then the mittens of the baby, wear it also. And same also to the feet, the boties, wear it also. And now for the grooming of the baby, let's comb the hair. Be sure to use a fine comb to prevent the head and scalp. Cover the head. And now let's proceed for the powder. Turn back away from the baby if you're using the powder. Then put it on the lower extremities of the baby. Then right after that, use this one, lotion. Be sure that you're using a hypoallergenic lotion because the baby's skin is delicate and sensitive. So, let's put lotion to the baby. You can use this to the upper extremities of the baby and also to the lower extremities. It is very okay. Now, cologne. So, put it on the clothes of the baby. Now, the baby is finished. So, let's get the baby and let's feed the milk for the baby. Get the baby from the countertop and hold in a cradle hold position. Then, get the feeding bottle and feed the milk. Then, after feeding, get a towelette, put it in your shoulder. Then, bark the baby. Then, after barking, let the baby sleep and sing a lullaby. So, then after that, if the baby is fall asleep, put it back on the crib. So, we will put the baby on the crib now. Then, after that, we will do the aftercare. So, we will keep these things, the materials that we use. Now we already done for the baby bath assessment. Always remember that the safety of the baby is always in our hand. So, be responsible all the time, wherever you are and whatever you do.